And I'm going to be talking to you on the topic of communicating with vision and hearing impaired people. So it's important when communicating with vision and hearing impaired people that you do not label them, that you see them as a person with unique needs rather than seeing them as their label or their disability. So sometimes we lose sight of people that have diagnoses. We treat that diagnosis, the disability or the label, and we forget about the individual. It's important to remember that they are an individual, they are a person, and everyone is different. Despite having the same disability or the same label, each individual has their own reactions to their disability. They have their own way of seeing themselves and how that disability or label relates to them. And also they differ in the impact on their communication. We must ensure that our language is non-biased and we see that individual as an individual with unique needs. So a person with a hearing impairment is someone who finds verbal or oral communication difficult because of an inability to hear. As I was saying before, all people with hearing impairment do not feel the same way. So they may feel differently about how the actual disability or impairment relates to them. And most people with impaired hearing have some residual hearing, so that's important to remember too. So hearing may fluctuate depending on environmental factors, physical factors, and emotional factors. So it's important to know what's going on in the broader picture for that individual. And most people with hearing impairment communicate orally. So let's look at some strategies for effective communication with the hearing impaired. So make sure the person can see your face when you talk to them. This provides rich information for the individual. Check if hearing is better in one ear and sit on that side if it's preferable for them. Check that the person is wearing a hearing aid if they have one. Consider a quiet location. So if there's a lot going on in your environment and it's drowning out your voice, it's preferable to take that individual to a quieter location where they have a better chance of hearing what you're saying. Speak up, but don't yell or bellow. Keep eye contact and use body language and facial expressions. So as I said before, this non-verbal information gives the individual a richer picture of what's going on and what you're saying. Speak clearly at normal pace. Don't speak slowly. Speaking slowly can be patronising. Use an Auslan interpreter if the person knows Auslan, so that's the Australian Sign Language. And also consider written communication if this is preferable for the individual. So now let's look at communicating with visually impaired individuals. So visual impairment does not only relate to total blindness, but may refer to impairments of visual acuity or visual fields, such as macular degeneration. So macular degeneration is where there's an impairment in the central part of vision, but the peripheral part or the outer part of vision is relatively intact. There's glaucoma, which is the opposite of macular degeneration. So this is where it's sometimes referred to as tunnel vision. It's where we have relatively good or intact central vision, but the peripheral part of our vision or the outer part of our vision is impaired. There's diabetic retinopathy. So this is a complication associated with diabetes where we have patchy vision. So there's no one part of vision or the visual fields that is affected, but rather it's patchy. And there's hemianopia. So hemianopia is where one part of vision is affected. So the left or the right, one side is affected. So strategies for effective communication. So it's important to address people by their name and introduce yourself. So don't assume that the other person can recognize your voice or knows that you're talking to them. In a group situation, introduce others Inform the person of any activities that are going on in the room that may be important, such as John has left the room. So the things that we take for granted that we see out of the corner of our eye, it's good to be aware that these individuals won't necessarily know that those things are happening or be aware of those goings on in the room. Speak naturally and clearly. Loss of eyesight does not mean loss of hearing. Continue to use body language, as this will influence your tone. Use everyday language, so don't avoid words like see or look, and use accurate and specific language. So don't, once again, assume that they know what you're talking about based on vision. So pointing to a general location and saying that the door is over there, or even just saying the door is over there. It's good to be specific with your communication. So say something like the door is to your left, or the door is straight ahead and then to your left. Always ask first to check if help is needed, because the person may not need help. So don't assume that they do. Magnifiers can be useful. When providing written information, consider the clarity of that information. So using black text on white paper because it stands out more. Using fonts that are easier to read, such as Universal or Arial, and putting them in sizes that are easier to read as well. So greater than 12-point font. You as a health professional might assist with reading out written materials for your client if this is preferable for them.